Systemic lupus erythematosus, or SLE for short, is a long-term autoimmune disorder that may affect the skin, joint, kidneys, brain, and other organs of the body. An autoimmune disorder means that the body's immune system mistakenly attacks a healthy tissue and leads to long-term inflammation. The underlying cause of an autoimmune disorder is not fully known. SLE is more common in women than it is in men, and SLE can also be caused by certain drugs. Some of the symptoms that SLE has may vary from person to person and may come and go. So the person may be in remission, where they don't show any signs of the disease, but they still have the disease. Everyone with SLE has joint pain and swelling. Some may develop arthritis. Frequently affected joints are the fingers, hands, wrists, and knees. Other common symptoms include chest pain when taking a deep breath, fatigue, fever with no cause, general discomfort, uneasiness, or ill feeling, hair loss, mouth sores, and sensitivity to light. Skin rash, or it is called the butterfly rash, which is over the cheeks and bridge of the nose. And this rash affects half of the people with SLE. Other symptoms may develop on what part of the body is affected most by SLE. The brain and nervous system have symptoms as headaches, numbness, tingling, seizures, vision problems, and personality changes. The digestive tract has abdominal pain, nausea, and vomiting. The heart, you can sometimes hear an abnormal heart rhythm. Lung, coughing up blood, and difficulty breathing. Skin, patchy skin color, or frequent color change of the fingers when they are cold. Some of the signs and tests that are used to diagnose lupus are antibody tests, including antinuclear antibody panel, CBC, chest x-ray, and urinalysis. And in order to be diagnosed with lupus, you must have 4 out of the 11 typical signs of the disease. And this is why lupus is very hard to be diagnosed. This disease may also alter the result of some of the following tests: antithyroglobulin antibody, antithyroid microsomal antibody, complement components, Combs test, and cryoglobulins. ESR, kidney function blood test, liver function test, and rheumatoid factors, because some of the symptoms from SLE show that they have rheumatoid arthritis, when in actuality that they don't. It is just a flare-up of SLE. There is no cure for SLE, so the goal that the doctors have is to treat and control some of the symptoms to make the patient as comfortable as possible. If you have a mild form of SLE, some of the medications you might take are non-steroidal anti-inflammatory medications, corticosteroid creams to treat the skin rash, or anti-malaria drug, other known as hydrochloroquine. And anyone who has SLE needs to wear protective clothing, sunglasses, and sunscreen when in the sun, because sunlight can actually make a skin rash a lot worse. Or some who have SLE have a higher sensitivity to sunlight. Also, if you do have lupus or SLE, you should take some preventative heart care and be up to date on all of your immunizations, because your immune system is a lot more weakened than a normal person. And last but not least, SLE is hereditary. It has been shown that there is a genetic mutation in your DNA from your parents and they can pass on SLE to their offspring. And also, another way that SLE can be caused or for anyone to get is by having a repeated change in your medication over time. And that messes up your immune system and your entire body, and your body doesn't know what to do, so instead it attacks your healthy cells. But I chose to do SLE for my second speech is because it is close to my heart, because my mom is suffering from SLE right now. And she was diagnosed about 7 to 8 years ago now. And she's doing well and everything as long as she stays consistent with her medication. And she goes and sees all of her multiple doctors that she has, because she has a regular primary care physician as well as a heart doctor, kidney doctor, and digestive tract doctor. And she takes several trips down to Boston each year for checkups to make sure there has been no changes to the damages that SLE caused when she was first diagnosed. And it was really hard when she was diagnosed because she was hospitalized and there were no answers to our questions. Once she was finally diagnosed, she got better and she was able to return back to work and continue on with her daily living. And now all she has is some minor flare-ups, which her fingers will swell, or her ankles or feet, or sometimes some other flare-ups sometimes cause her to have trouble breathing. But she goes and sees her doctor immediately and she receives the proper treatment, and she has had no other issues. So I hope by listening to my speech, you all can learn from SLE and know that it is no joke and it is a very hard disease to deal with. But with a little bit of help and the love of your family and friends, and there are support groups out there for those who not only suffer from SLE, but any type of lupus, to help them get through the rest of everything and to also help them get the proper treatment from the proper doctors that is needed. Thanks for listening.